My name is Mikhail Klimstra. I'm an orthopedic surgeon here at Summit and sports medicine trained. For undergrad, I went to University of St. Thomas. Then I went over to the University of Minnesota for medical school. Completed my residency also at University of Minnesota, and then I spent a year in Albuquerque, New Mexico at the University of New Mexico for a sports medicine fellowship. Treating patients is a team approach, and it's one in which, as a surgeon, as a physician, I can help identify the problem a patient's having, and from there we can kind of build a treatment strategy based on what they feel like is the best next step. And so that doesn't always mean surgery. Sometimes it means trying some non-operative stuff, and a lot of times that's just built around what they think is most convenient, what they feel like is going to be most beneficial for them, and then we just follow them. And I like to think that there's a good amount of dialogue, there's a good amount of education that happens just so they understand what's going on and they get a good sense of, what they're dealing with, what the next steps are going to look like, and coming up with their best treatment strategy. One of the reasons that I chose sports medicine is because you can still have a wide breadth of patients that you see, and that includes, age from young to old, patients who have different activity levels, whether that's competitive sports to folks who just want to stay active, have a problem, aren't happy with their function or happy with their quality of life. That's kind of the group of patients that I'll be treating. I think the big thing is the people, and that includes patients, but also the team that I'm working with. I think people in general are quite motivated to want to get better. They're appreciative when you take time to listen to them. They're appreciative of getting back to a better function and a better quality of life, and that's what keeps me going. That's the enjoyable side of things, is the interaction that I have with both the folks I work with, but also the patients I take care of. Well, a lot of the time I have outside of work is with the family. So with my wife and my daughter, we spend a fair amount of time around house, playing. One of the things we like to do as a family is cook, and so in the evenings, on the weekends, we spend a lot of time in the kitchen. Being outdoors, obviously, growing up in Minnesota, that's one thing that you just have to take advantage of. So I like to be on the water, I like fishing, I like boating. Wintertime is fun too, snowboarding, kind of just enjoying the outdoors of Minnesota.